Drummond, MA, RDN, CDN. She's a New York-based registered dietitian and certified health education specialist. She joined the Westchester County Department of Senior Programs and Services in April 2021. Yeah. Prior to joining the Westchester County Department of Senior Programs and Services, she worked in clinical and community settings that include pediatrics, adults, and geriatrics in group homes, long-term care facilities, and adult care settings, where she provided oversight to the nutrition department for the group homes and individual nutrition counseling education. She was an adjunct faculty member at Westchester Community College from 2017 to 21 in the nutrition department and the program director for certified dietary managers. She is president of the Westchester Rockland Dietetic Association for Professionals in Dietetics. Her belief about health is that it incorporates the physical, spiritual, and emotional aspects of a person, as all three are important to maintain and achieve good health. Welcome, Krish.
Thank you, Deb. Thank you, everyone. I just want to say a very, thank you to Louise for inviting me on this call and to be part of this discussion. And also, Hannah, we met a few times, and everyone else, I'm happy to be here. As Deb mentioned, I started with Westchester County 4 months ago. It's been an amazing 4 months. It's been totally different from, my clinical career, and now it's back, to civil service. So I know I have a presentation, but I just wanted to say, so my goal today is to give you a little bit more information about what Westchester County Department of Senior Services provides, and also, an overlook of our nutrition sites. So I'm going to share my screen. Can everyone see that?
Yes. Yep.
Okay, great. Okay, sorry, I always have technology difficulties right here. So the mission of our Westchester County Department of Senior Programs and Services, we want to identify and prioritize the needs of the elderly that live within Westchester County. We also, part of our program mission is to create plans for meeting those needs. And, we have different units within our organization that advocates for policies, programs, actions, legislation, and resources on behalf of our population. We also administer programs under the older American Acts of 1965. And basically that's, our governing program mandates. So we usually target eligible older adults, and this, the adults could be low income, they could be medically frail, or any medical conditions, and even if these individuals are isolated. Now, within the Department of Senior Programs and Services, the nutrition unit follows the regulations under these grants, and there are certain grants that we fund to certain senior centers. So the federal grants, there are various titles, and I'm not going to go into detail as to what the funding sources are. Usually they Title 3C1, which is for our congregate meals, and our Title 3C2 for our home delivered meals. So our nutrition unit oversees the food and nutrition services to the senior centers. We have 16 municipalities in Westchester County, and within these municipalities, we have 23 contracted senior centers. We also have 6 regional kitchens and 4 caterers. Now, our regional kitchens produce some of the meals and distribute them to our senior sites, and our caterers do the food production on site and then provide them to the seniors. So just to give you an overview of the meals that we serve, in 2020, we served about approximately 35,000 congregate meals to 1,865 people. And then, the pandemic hit in March, and we had to change all our congregate meals to home delivered meals. So we started serving roughly about 434,000 meals that transitioned to home delivered meals, and these were to 3,680 people. So for the year of 2020, we served approximately 469,000 meals to 5,545 people. And then I just got a year to date from January to July this year. We've served about 246,000 meals to 3,867 people. So as you can see, due to the pandemic, the need for meals increased. So one of our goals of the nutrition services is to improve the nutrition and health status of our seniors that live within Westchester County. How do we achieve this? So we achieve this, one, by providing congregate and home delivered meals. That our home delivered meals are freshly prepared on a daily basis.
I'm not on mute.
And distributed from Monday through Friday. During the pandemic, our meal deliveries were tailored. Our nutrition sites had to change how to deliver meals. So the meals were cooked fresh, frozen, and then they were delivered. To our seniors, there was lots of non-contact delivery, and deliveries were usually done around 2 to 3 times a week. The goal of our congregate dining program was to provide nutritious, balanced meals, also to improve socialization, and we also provide health and wellness programs within our senior center. During the pandemic, as most of you know, that our nutrition sites were closed, and these seniors were moved to home delivered meals. Currently, as of the end of July, we have 9 out of our municipalities that are opened, and they are providing on-site meals. So it's good to see that the seniors are excited to come back. They miss that socialization, and we also at the same time have to be really careful and safe how we bring back our seniors. So the congregate meals are senior sites. There is an eligibility criteria that each senior enrolled in our program has to meet. If you're a senior who's 60 years and older, you will qualify for our program. The congregate nutrition site services, there is no income requirements. And also, if you're an individual with disabilities under the age of 60, residing at home with somebody who's eligible, you qualify to attend our congregate nutrition sites. Usually on intake, there's an initial client assessment, which is completed by a licensed social worker or one of the registered dietitians on our team. And we have this so that they could, receive comprehensive nutrition care. The next point of contact is a 6-month contact and then a reassessment every 12 months. Usually with our initial assessments, medical forms are sent to the primary care physicians. We notify them of the meals that we're serving, and we request for their consent to continue to provide these services. Most often we get an annual physical. The physician will include a special diet or any restrictions, include medications and lab values, and the dietitians will assess this so that they could provide the best nutrition care plan to our seniors. The home meal services also has an eligibility criteria, and this too very similar to the congregate meals. If you are any person over 60 years or older, if you are incapacitated due to illness or an accident, and you cannot, cook or provide your own meals. Also, if you lack support of family, friends, or neighbors. So if you live alone and somebody is not able, and you're not able to cook for yourself, we will deliver a meal to you. Also, individuals who are unable to prepare meals due to medical condition or due to lack of facilities. So you might not have a stove, you might not have a microwave to reheat our food, or you don't have an oven to cook or bake. Sometimes if you don't have electricity. So these are basic things that we take for granted that certain people don't have access to. Also, lack of knowledge or skill, so you don't know how to make a meal or you've never cooked before. The lack of knowledge or skill is the last criteria. You have to be medically ill to receive these services. And then also individuals with disabilities under the age of 60 who reside at home with an eligible participant. So if I am if I'm eligible for the meal and I have a child who's disabled, that the child will qualify for a home delivered meal. So usually there is no wait list. Our senior centers are opened. When they are opened, they will invite everyone to be part of our senior center. If there is a wait list, it's usually a short time period. Priority is usually given to individuals who have medical needs and their living status. So if somebody who lives alone, who lives alone and is medically ill, they will get priority to attend our senior centers to receive home delivered meals. Usually the contact program or staff assigned to the program will call the individual to get the specific information and do the initial assessment. We do have a suggested meal contribution, but it does not include income requirements. Our programs ask for a suggested meal contribution just to offset some of their program expenses. And contributions are confidential. Some programs will state, oh, there's a $2 donation. Some programs will state $4 donation. It is what you can afford to give. And if you cannot afford to, give a meal contribution, you are not excluded from our programs. So we try to make it very inclusive. Coming back to our unit and what the nutrition services do, we have 3 registered dietitians on staff. They provide monitoring to all our programs within Westchester. The dietitians prepare a 9-week cycle menu, and you're probably wondering what cycle menu means. So after 9 weeks, the menu is repeated, and we provide both hot and cold. We have to think of our delivered individuals who receive cold or frozen meals, so we have to make sure that our meals, or our menu will cater for that. Each meal has to meet the program standards, which is usually 1/3 of the recommended dietary allowances for older individuals. And what that basically means is that if you're supposed to have 3 servings of starch, our meal should at least have 1 serving of starch. The dietitians do develop all the recipes, and our recipes have to be analyzed to make sure that they're meeting the nutritional content of the recommended dietary allowances. And then our programs, which are senior sites, are monitored for food safety and sanitation under the New York State Department of Health regulations. So our dietitians go to the programs and they, do a monitoring, make sure that they're following all the sanitation regulations. If they see something, usually it's an incidental teaching, or they'll give them a report telling them what needs to be fixed and the time frame. So just to, it's important for older adults to eat healthily. And even if, they don't have access to all the food groups, they should be incorporating at least 2/3 of the food groups in their daily meal plan. So the MyPlate for older adults, I love using this because it's a great visual. When you're doing a nutrition education to older folks, some of them might not be able to identify what a fruit, what a protein is, or grains. Just by using this visual, we could say, hey, you could eat maybe 2 slices of bread or a cup of serving of pasta, which will be too much, but or like 3 ounces of, protein. So depending, and we want our dietitians to use this as an education tool when they go out to our senior centers. Besides the nutrition services that we provide, the meals, the dietitians also provide nutrition education. The nutrition education is a required services under the grants. It is used to promote better nutrition, physical fitness, and provide information to our seniors. It is usually conducted, as I said, by our registered dietitians. So on our team, we have registered dietitians, so they will go out and provide the education. We also provide information and instruction in group settings or throughout any of our senior centers, and also distribute materials to the individuals. So we do provide a nutrition newsletter that goes out on a monthly basis. So the nutrition news is our monthly education handout. It's usually distributed at our senior center, or it's delivered, or it's put into the home delivered meal package and sent to the senior. Nutrition presentations are also conducted by our dietitians throughout the county, and this is relevant to what topic a senior center want to discuss. So we promote falls prevention. And part of that is we talk about foods that, assist in healthy bones to prevent falls. We also, we have a calendar in our department on a monthly basis, and based on what the nutrition news for that month is, we will provide the education. Just to give you an example of what our nutrition news looks like. So this goes out to the senior centers, and then it also goes out to our home delivered meals. Another service our unit provide is nutrition counseling. So the dietitians provide a one-on-one counseling, and here it's to assess and implement a nutritional care plan for the individual. If our individuals are high risk, we tend to see them more often, at least once a month, depending on their risk levels. They'll get seen a month, two times a month, or once every 2 months. And we have to reassess every time we see them. We also provide follow-up counseling for our seniors, and once the dietitian determines that this person is no longer at risk, then their counseling will end. Other activities that our department or unit does is we participate in the New York State Senior Farmers Market Nutrition Program. That program usually runs from June to November. We have just received all our nutrition, the farmers market checks. We have distributed them to our senior centers, and upon receiving those checkbooks, the senior centers will distribute it to their seniors. The farmers market program, however, has an income requirement. So based on what your annual income is, you will qualify to receive those checks. Our unit also participates in emergency meal programs, and this is implemented for the inclement weather during winter, or if there are any program closings. So during the pandemic, we partnered with Feeding Westchester, and we provided emergency meals to most of our senior centers. And then we also send out a monthly and annual client satisfaction survey to our programs. The survey includes, questions like, did you like our menu? What do you want to change? What items do you want to see on the menu? Do you want any presentations? What type of presentations you want, So it's great for us because we get feedback from the seniors that attend the center, so that we can change and tailor our menu to suit their needs. Now, I always said this, you can't satisfy everybody's needs, so our goal is to satisfy at least 80% of our seniors that come to the program, to provide a meal that they will enjoy. Also, our nutrition campaigns throughout the year. We have National Nutrition Month in March and National Senior Health and Fitness Day in May. We also have Health Prevention Awareness Day in September. And a lot of our cooling centers, a lot of our senior centers act as cooling and warming centers for their communities. And then also within our department, countywide, we provide the annual salute to seniors. This is usually held at the county center. In 2021, that was this year, we had to reimagine this. It was done at 4 different locations. It was outdoors. I have to give credit to the department that did that. Nutrition was not involved in this. But hopefully moving forward, we'll be more involved in this. We also do the Saxon Lids Senior Pool Party and Barbecue. Last year and this year it was canceled. We're hoping, if things get better or improve, to have this in June of 2022 next year. And then we also plan the Golden Harvest Dance and Talent Show, which is usually held around September. And that we have no plans for that for this year yet. We just have to wait and see what's happening. And then also, I am part of the collaboratives. Two of the collaboratives are the Health and Wellness and the Hunger Collaborative. So Health and Wellness is mainly, our senior centers, the recreation department within the county, providing mental health and also providing some dental health education. And then the Hunger Collaborative is based on decreasing hunger in Westchester County, and that we are liaising with Feeding Westchester once again, because they have a huge program in Westchester County, and here we want food to be accessible to our seniors. So the dietitians will provide nutrition education, home delivered meals. We have, with Feeding Westchester, they have teamed up with Meals on Wheels and the food stamp program, and also providing food pantries within Westchester County. So that's about it in a nutshell. Thank you.
Thank you so much, Krish. If anybody has any questions, now will be the time to ask. I see a couple of items in the chat. Mary Kay has shared her contact information. Mary Kay, do you just want to talk about chronic disease or any of the programs that you run along with your contact info?
Sure, I'd be happy to. And then I also have a comment and a question for Krish. So there are a couple of health and wellness programs that we offer throughout the county to older adults, focusing primarily on chronic conditions, chronic disease self-management, chronic pain self-management. We also offer those in the workplace and in Spanish. And then, and I'm sure Deb can talk about building better caregivers when the time comes. Those workshops are also available. In light of the pandemic, we used to do them in person. We're now doing them by Zoom and by telephone. Again, they're at no charge. It's a Stanford University-based, evidence-based programs, and those who participate and finish the class get to keep a very handy reference book. My drawer won't open to show you the book. And exercise and relaxation CDs. So highly encourage you to take advantage of them. And then Jen, I don't know if you want to go around and I'll come back to my question and comment.
No, I think if you have a question for Krish, go right ahead.
First is a comment. Krish, I just wanted to give kudos to you and your staff. COVID was certainly unexpected, and your group really had the tremendous challenge of figuring out how to keep people fed, even though you couldn't get them together. in person. So that was a huge logistics and kind of pivot point. So kudos to all of you. The question I have, and you touched on it a little bit when you talked about collaboratives, is how you coordinate with Meals on Wheels versus the nutrition centers and Feeding Westchester. How does that work?
So I just want to say this, I am so new that I haven't even touched on that yet with them. Yesterday I had a conversation with Toby Pigeon, who's the Vice President for Feeding Westchester, and we are going to collaborate on how we could, work together as partners. From my previous experience is that with Feeding Westchester, and this is outside the county, is that they have such a huge network, and they have pantries on their website. They have mobile pantries and drive-through pantries that are set up all over Westchester County. They're also part of the Farmers Market program. And they link the private Meals on Wheels with our seniors. And what I found is that we have home delivered meals within Westchester County, but we don't have a resource with or connection with our private Meals on Wheels. And that is one thing I wanted to reach out, because I've been getting a lot of calls, people that live, like we have 16 municipalities. So if somebody that lives in Rye, we don't have a senior center in Rye. So we can't access or help that senior that lives in Rye, but there are private Meals on Wheels organizations there. So we're hoping that, to form a liaison with these private companies so that we can assist everyone. And that was there's a gap, which I felt because of the 16 municipalities, it's only in certain areas we're not reaching everyone. Because I had somebody call me that lived in Rye. We did not have a senior center there, so we couldn't do home delivered meals. I had to refer this person to a private Meals on Wheels company.
I have a question, Krish. Can you hear me, or am I on mute?
No, I can hear you.
Okay, great. One of my biggest frustrations when my mom was alive, at the last few years of her life, was dentures and hearing aids. And I mean, to me, both are necessary for your cognitive and physical health. And the Medicare or the plans, they really, you really have to be private pay to get those. And my mom was in rehab, they accidentally threw away her hearing aid and her dentures, and of course got a new replace it. And I was shocked when the receptionist at the dentist office says, "Oh, most people her age just don't even bother with denture," And I was saying, how can they get nutrition if they can't chew? So is the government in any of these new bills recognizing for this problem and doing anything about it? I know Nita Lowy tried, but I don't know where that is now.
So once again, that's a great question, and I'm so new to this. About do some research. What I did find out is that the Older American Act is in the very early stages of customization. So hopefully somewhere in that act, they have dental health. And I do understand, when you work in long-term care facilities, people don't really check the plate. If somebody takes out their dentures and leave it on the plate, that often gets thrown away. And good nutrition, if you have ill-fitted dentures or you have no dentures, you might not get the proper nutrition that you need. So it is important, to have dentures or, have dental visits. But I could follow up with you.
Yeah, I'm just curious because I'm finding with a lot of dentists now, I don't even know how many of them do that because they just want to do implants. And a lot of seniors can't afford the implants. So I'd be curious to know if there's any move in that direction.
I could look into it and get back to you.
Thank you.
You're welcome.
So I see from the chat, Donna West from FSW Project Hope is here with us, and this program will be ending in December 2021. Welcome, Donna. If you have a question, please feel free to ask. And Krish has shared her email. If anybody doesn't see it in the chat, kqdk@westchestergov.com. So if anybody else has a question, feel free to put it in the chat or unmute yourself.
I have a question about the farmer's market. Is it any farmer's market around Westchester? And like, do they get coupons or is it specific farmer's markets?
So we have a specific farmers market that is under New York State. I could pull up the list for you if you give me a second and or send it via email. So it is the farmers market. It's not just any farmers market. They have to participate in the New York State program, and the checks are also at the senior centers. So I could also provide a list of senior centers that have the checks. If you have seniors that want to get the checks, they have to call the senior center and register for the checks at the senior center. But it's any senior in Westchester County based on income.
Thank you.
You're welcome.
And Krish, I have a question or a comment with the collaboration you're talking about with the county and some of the local private Meals on Wheels programs. That would be something that our foundation would be very interested in, helping to support if there's things that the county can't cover or something. So if you could, I'll put my contact information in the chat and, we could talk about it or keep me in the loop on that. That would be great.
Okay, that would be great too. Thank you for reaching out.
Thanks.
There aren't any other questions. I am going to turn it over to Hannah to wrap it up.
Okay. First of all, I want to just remind you that we have a meet and greet. So I want to encourage you to encourage other people from your organizations or come yourself. Jen, can you repeat what day it is?
Sure. So our village meet and greet will be on Thursday, August 26th from 10:30 to 12 at Ridge Road Park in Hartsdale, and we are at Pavilion 1. We have invited all of our village partners to come and to network and to chat and to enjoy seeing everybody in person. We envision this to be kind of a really nice networking event, but certainly also being able to share what services, resources are available and, finding ways to partner too. So again, August 26th, 10:30, Ridge Road Park in Hartsdale.
Great. I hope people will come and encourage other people to come. I think it's going to be beautiful weather, I promise. So it should be a nice day out, a good day out of the office or out of the home office, whichever you're working in. Thank you, Patty. I saw that you put something up in the chat. Is there any other announcement that anybody else wants to make? Any other programs that somebody wants to announce or items they want to add?
I just want to say something. I know I have some of our DSPS staff here. Since I've joined, everybody has been amazing. The support that I have from them. So I'm so new to this, and the support that I've had from my team and from the other units and Mary Kay and Jennifer has been amazing. I know Hannah has reached out to me, Louise has reached out to me. So I hope moving forward, and I know I have big shoes to fill because my predecessor and Darcy was amazing. So I'm excited to be part of the Westchester DSPS team, and I hope that I could do more. And in time, I want to do more. And I'm happy to meet all of you. And thank you so very much for having me on this call.
It's been a pleasure, and we look forward to interacting with you at many more occasions.
Yes. And
Thank
I want
you.
to
Thank
thank you
you.
very much for being here.
Welcome
Go ahead,
aboard.
Dan, you want to say something? Yeah. Welcome aboard. We're really glad you're here. And you have great credentials and the right spirit. So I'm very pleased you're taking over for Anne. So I thank you all very much. Any other final comments anybody wants to say? Well, then we're going to wrap it up, and I'm going to say it was very good seeing everybody, and we'll see you at the meet and greet if you can make it.
Bye-bye.
Thank you very much.
Bye.
Have a
Thank
good
you.
Bye, everyone. Have a nice weekend.
Take care.
Thank you. Bye-bye, Krish.
Thank you for coming.